If you're watching this video, there's a pretty good chance you've got a bottle of multivitamins somewhere in your kitchen, maybe on the counter next to the coffee maker, maybe in the cabinet with your other medications. And if you're over 60, I'm willing to bet someone, a doctor, a friend, maybe even a TV commercial, has convinced you that taking those vitamins every morning is one of the smartest habits you could possibly have. A little something for your bones, something for your heart, maybe one of those B-complex formulas for energy. It all sounds so sensible, doesn't it? So responsible, so proactive. But here's what I need you to understand, and I need you to really hear this, because it goes against everything you've probably been told for the last 30 or 40 years. Some of those vitamins, the exact ones you're faithfully swallowing every single morning thinking you're protecting yourself, might actually be doing the opposite. They might be quietly, gradually, invisibly making you sicker. Now, I'm not talking about some fringe theory here. I'm not some alternative medicine guru telling you to throw out all your supplements and start eating only organic kale. I'm Dr. Kent John. I've spent over 2 decades in clinical practice working primarily with patients over 60. And what I'm about to share with you comes directly from peer-reviewed research, large-scale clinical trials, and frankly from watching too many of my own patients suffer from problems that could have been avoided if someone had just explained this to them earlier. The issue isn't that vitamins are bad. The issue is that your body at 65 or 70 or 80 is not the same body you had at 40. Your liver doesn't filter the way it used to. Your kidneys don't flush out excess nutrients with the same efficiency. Your digestive system doesn't absorb things the same way. And most importantly, your body doesn't need the same things it needed when you were younger. So what happens when you keep taking the same supplements you took 20 years ago? Or when you follow advice designed for the general population rather than for aging adults specifically? Things build up. Things go to the wrong places. Things that were supposed to help you actually start causing damage slowly, subtly, in ways you'd never connect to that innocent little pill you took with breakfast. And here's the part that really bothers me as a physician. Most of the symptoms this causes, the fatigue, the joint pain, the foggy thinking, the dizziness, they look exactly like what people expect from getting older. So, nobody questions it. You don't question it. Your doctor might not question it. Everyone just assumes, well, that's what happens when you age. Except it's not. Not always. Sometimes it's toxicity, sometimes it's excess. Sometimes it's a vitamin that's been marketed to you as essential when your body actually can't handle it anymore. So, in this video, I'm going to walk you through 4 specific vitamins that after 60 can become genuinely dangerous if you're not careful. And then I'm going to show you the 4 that you absolutely should be taking, the ones that have the strongest evidence behind them, the ones that can actually protect your brain, strengthen your muscles, support your heart, and yes, even help you live longer. And I'm not asking you to just trust me. I'm going to show you exactly why, with real research, real mechanisms, real numbers, because you deserve to understand what's happening inside your own body. So let's start with the first one, and this might surprise you because it's been pushed on seniors for decades. Worst vitamin number 4, vitamin A in the retinol form. Now, when I tell my patients that vitamin A can be a problem, they look at me like I've lost my mind. Vitamin A is good for you. Everyone knows that. It supports vision, it helps your immune system. It's in basically every multivitamin on the planet, and all of that is true. Vitamin A is absolutely essential. The problem is the form most supplements use, which is called retinol, and the fact that after 60, your body handles it completely differently than it did when you were younger. Here's what happens. Vitamin A is what we call fat soluble, which means it doesn't dissolve in water and get flushed out through your urine like vitamin C or B vitamins do. Instead, it gets stored in your liver and in your fatty tissues, and it can stay there for months, even years. When you're young and your liver is working at full capacity, this isn't usually a problem. Your body regulates things pretty well, but as you age, your liver slows down. It processes things less efficiently. And here's the critical part. Your fat distribution changes. You store fat differently. You metabolize it differently. So that vitamin A you're taking every single day doesn't just get used and eliminated, it accumulates. And when it accumulates past a certain point, it becomes toxic. Now, the early symptoms are things you'd never connect to a vitamin. Your skin gets dry, your hair becomes brittle, you feel dizzy sometimes, especially when you stand up quickly. Your joints ache, you're tired all the time, you might even have blurred vision, which is ironic because you were taking vitamin A to help your eyes. But those symptoms, frustrating as they are, aren't even the scariest part. The scariest part is what's happening to your cardiovascular system. There was a review published in 2022 in the European Journal of Clinical Nutrition that looked at seniors with elevated vitamin A levels, and what they found was striking. Those individuals had a 25% higher risk of developing atrial fibrillation. That's an irregular heartbeat that dramatically increases your risk of stroke. And we're talking about people over 65, where stroke is already one of the leading causes of death and disability. So you're taking this vitamin thinking you're protecting yourself, and instead you might actually be increasing your risk of one of the most devastating health events that can happen to a senior. Now, here's what I tell my patients when they ask, how much is too much? If your multivitamin contains more than 700 micrograms per day for women, or 900 for men of retinol, or something called retinol palmitate, those are the synthetic forms, you're already in the danger zone. And most senior-focused supplements blow right past that number without any warning on the label. But here's the good news, and this is important. You don't have to give up vitamin A completely. Your body still needs it. You just need to get it in the right form. That form is called beta-carotene, and it's found naturally in foods like sweet potatoes, carrots, spinach, butternut squash, eggs. When you eat beta-carotene, your body converts it into vitamin A, but only as much as you actually need. It's self-regulating. There's no risk of overdose because your body simply stops converting it once you have enough. Think of it this way. Retinol from supplements is like someone pouring water into a glass that's already full. It just overflows and makes a mess. Beta-carotene from food is like having a smart faucet that only turns on when the glass is actually empty. So, here's what I want you to do today. Go to your medicine cabinet, pull out your multivitamin, look at the label. If you see the words retinol or retinol palmitate and the amount is anywhere near or above those limits I mentioned, it's time to make a change. Switch to a formula without preformed vitamin A. Or better yet, just eat more orange and dark green vegetables and let your body handle the rest. Because after 60, being healthy isn't about taking more pills. It's about taking the right ones in the right forms at the right doses. All right, let's move to the second one. And this one is tricky because it's been marketed to seniors as an energy solution for decades. Worst vitamin number 3, iron supplements. When most people hear the word iron, they think energy, they think strength. They think about those old Popeye cartoons where spinach made you instantly powerful. And for certain people, at certain times in life, iron supplementation is absolutely necessary and life-saving. But here's what almost nobody tells you. After 60, unless you have a diagnosed deficiency, extra iron doesn't give you energy. It just builds up in your organs and slowly poisons you. Let me explain the biology here because it's actually pretty straightforward. Iron is not like other nutrients. Your body doesn't have a good way to get rid of excess iron. There's no elimination pathway. You can't sweat it out. You can't urinate it out. Once it's in, it's stored primarily in your liver, your heart, and your pancreas. Now, when you're younger, especially if you're a menstruating woman, you lose iron regularly through blood loss. So supplementation often makes sense. But men stop losing iron after puberty and women stop losing it after menopause. That means the natural drain is gone. So what happens when you keep adding more iron on top of what you already have? It doesn't disappear, it accumulates. And as it accumulates, it creates what's called oxidative stress, which is essentially rust forming inside your body, damaging your cells, aging your tissues, and increasing your risk of serious disease. A study published in 2018 in Alzheimer's Research and Therapy found a direct link between excess iron levels in the brain and higher rates of dementia. Other research has connected it to heart disease, liver damage, even certain cancers. And here's what really bothers me. Most seniors taking iron supplements don't actually need them, but the symptoms of iron overload are so vague that nobody makes the connection. You feel tired, but you assume that's just age. Your joints hurt, but you figure that's arthritis. You have trouble concentrating, but you think maybe that's early memory decline. Your heart skips a beat sometimes, but you don't mention it to your doctor because it doesn't seem like a big deal. Meanwhile, that iron supplement you're taking every morning, the one that's supposed to be giving you energy, is quietly accumulating in your heart muscle, in your liver tissue, in your brain. And here's the real kicker. Many popular senior multivitamins still include iron, even though the vast majority of older adults don't need it. And if you're also eating iron-rich foods like red meat, beans, fortified cereals, you're stacking it even higher. So, what should you do instead? First, check your labels. If your multivitamin includes iron and your doctor hasn't specifically diagnosed you with iron deficiency anemia, you need to switch to an iron-free formula. They exist. They're specifically designed for seniors who don't need extra iron. Second, get tested. Don't guess. Ask your doctor for a serum ferritin test or a transferrin saturation test. This will show you exactly where your iron levels are. If they come back normal or high, you have your answer. Stop supplementing. Third, trust your diet. You're going to get plenty of iron naturally from lean meats, beans, leafy greens. You don't need a pill on top of that, because here's the truth. After 60, your energy doesn't come from iron supplements. It comes from protecting your organs, reducing inflammation, and giving your body only what it actually needs, not what a marketing campaign told you to take. All right, number 2. And this one is going to shock people because it's probably the most recommended supplement for seniors in the entire world. Worst vitamin number 2, calcium supplements, especially when taken alone. For as long as I can remember, seniors have been told the same thing over and over again. If you want strong bones, you need calcium. Take it every day. It's non-negotiable. It's in every osteoporosis pamphlet, every bone health commercial, every senior multivitamin on the market. And I get it. The logic seems airtight. Calcium builds bones. Seniors lose bone density. Therefore, seniors need more calcium. Simple. Except it's not simple at all. Because after 60, your body doesn't handle calcium the way it used to. And when you take calcium supplements without the right supporting nutrients, that calcium doesn't go where you want it to go. Let me paint you a picture of what actually happens. When you're young, your bones are like sponges, actively soaking up calcium with the help of hormones and growth factors that tell your body exactly where to send it. But after 60, that hormonal signaling weakens. Your bones stop absorbing calcium as efficiently. So where does all that extra calcium go? Into your arteries, where it hardens your blood vessels and raises your risk of heart attack and stroke. Into your joints, where it contributes to stiffness and pain. Into your soft tissues, where it causes calcification that your body can barely reverse. A review published in 2016 in the Journal of the American Heart Association looked at seniors taking calcium supplements, and here's what they found. Those individuals had a 22% higher risk of heart disease compared to those who got their calcium from food sources. Let that sink in for a second. You're taking calcium to protect your bones, and you might actually be weakening your heart. And the cruel irony, your bones might not even be getting stronger because calcium on its own can't do the job. It needs help. It needs vitamin D3 to absorb into your bloodstream in the first place. It needs vitamin K2 to direct it into your bones and keep it out of your arteries. It needs magnesium to balance the whole system. So calcium doesn't just harden everything it touches. If you're taking a plain calcium pill, a standalone supplement with nothing else in it, your body has no guidance. That calcium just floats around until it lands somewhere. And too often it lands in the wrong place. Now, the early symptoms of calcium overload are things you'd never suspect. Bloating, constipation, aches in your joints, fatigue, brain fog. But over time, you're looking at calcified arteries, higher risk of stroke, recurrent kidney stones, and ironically, bones that still aren't any stronger. So, what should you do instead? Focus on food first. Leafy greens, sardines with bones, yogurt, almonds, chia seeds. These provide calcium in a natural, absorbable form that your body knows how to handle. If you truly need supplementation, and some people genuinely do, never take calcium alone. Always pair it with D3, K2, and magnesium. That combination ensures the calcium goes into your bones, not your blood vessels. And move your body. Weight-bearing exercise, walking, resistance training, even just standing and balancing is just as important as calcium for bone strength. Maybe more important. Check your total intake. If your multivitamin already gives you 500 to 800 milligrams daily and you're eating calcium-rich foods, you might already be overdoing it. Because here's the reality. Calcium is vital, but not the way you've been told. On its own, in supplement form, it can clog arteries, stiffen joints, and increase your risk of the very thing you're trying to avoid, which is cardiovascular events. Real bone health comes from balance. From getting calcium through whole foods, from combining it with the right vitamins, from keeping your body active after 60, it's not about piling on more pills. It's about making sure the nutrients you take go exactly where they belong, into your bones, not your arteries. All right, now we get to number 1, and I saved this one for last because it's the most counterintuitive. And honestly, it's the one that surprises my patients the most. Worst vitamin number 1, high-dose vitamin B6. When people hear vitamin B6, they think harmless. It's a B vitamin. It's water-soluble. It helps with energy, with nerve function, with mood. What could possibly go wrong? Here's what goes wrong. Unlike most B vitamins, which your body flushes out pretty easily, B6 behaves differently when you take it in high doses. It accumulates in your nerve tissue, and over time that accumulation becomes neurotoxic. It literally poisons the nerves it's supposed to be protecting. And seniors are especially vulnerable because your liver clears toxins more slowly than it used to, and your nerves are already more fragile just from the aging process itself. A study published in 2017 in the journal Neurology looked at older adults taking high-dose B6 supplements, and what they found was alarming. Those individuals had double the risk of developing nerve damage symptoms compared to people who stayed within safe limits. But here's the insidious part. The symptoms of B6 toxicity look almost identical to what people expect from normal aging. Tingling in your hands and feet, numbness, burning sensations, poor balance, frequent falls, muscle weakness, fatigue, brain fog that just feels like getting older. So, nobody connects it to the vitamin. You don't. Your doctor might not. Everyone just assumes, well, that's what happens when you're 70. Except it's not age, it's toxicity. And the worst part is, even though the official safe upper limit for B6 is set at 100 millimolar per day, research shows that even 50 millimolar daily taken over long periods can cause toxicity in older adults. And guess what? Many nerve support formulas, many energy boosters, many senior multivitamins on the market contain 100 to 250% of the daily recommended amount in just one serving. Stack that with your regular multivitamin, maybe some fortified cereals or energy drinks, and you could be unknowingly overdosing every single day. And unlike a deficiency, which is usually easy to fix, nerve damage from too much B6 can take months, even years to recover from. In some cases, the damage is permanent. So, what should you do? Stick to food sources. Chickpeas, tuna, turkey, bananas, potatoes, fortified cereals. These give you all the B6 you need safely without any risk of overload. Know your actual daily requirement. Seniors only need about 1.5 mg for women and 1.7 for men. That's it. Not 50, not 100. Less than 2 mg. Check your supplements. If your multivitamin or nerve support formula has more than 5 to 10 mg of B6 per serving, it's time to switch. And if you're concerned, ask your doctor for a B6 blood test. Don't just take high doses just in case, because when it comes to B6, more is not better. More can be dangerous. Alright, so those are the 4 vitamin A and retinol form, iron, calcium when taken alone, and high-dose B64 vitamins that sound helpful that have been marketed to seniors for years, but that after 60 can quietly cause real harm. And I know that might feel overwhelming. You might be looking at your supplement bottles right now wondering what's safe to take at all. But here's the good news. Avoiding danger is only half the equation. The other half is fueling your body with what it actually needs. And certain vitamins and nutrients don't just help a little. They can genuinely restore strength, protect your heart, sharpen your memory, and extend your lifespan. These next 4 are backed by some of the strongest research in senior health, and one of them has been linked to a 36% lower risk of death from all causes. So let's shift gears. Let's move from what you should never take to what you absolutely must take if you want to stay strong, steady, and sharp well into your 70s, 80s, and beyond. Let's start with number 4. A mineral most seniors are silently low in, yet it powers over 300 functions in your body. Best vitamin number 4, magnesium. If there's one nutrient that almost every senior I see is running low on, it's magnesium. And the tricky part is, you often don't even know it's missing until your body starts sending signals that seem completely unrelated. Trouble sleeping, muscle cramps at night, unexplained fatigue, restless legs, even an irregular heartbeat. Most people shrug these off as just part of getting older, but more often than not, these are textbook symptoms of magnesium deficiency. Magnesium matters more than most people realize. It's involved in over 300 biochemical reactions in your body. It keeps heart rhythm stable, allows muscles to contract and relax properly, supports nerves and brain activity, regulates blood sugar, and strengthens bones alongside calcium and vitamin D. But aging creates a hidden problem. Your body absorbs less magnesium from food, and many common medications, blood pressure drugs, reflux medicines, and diuretics actually drain magnesium faster than you can replace it. So, even with a decent diet, levels quietly drop year after year, and the consequences are serious. A 2018 study in Nutrients found magnesium deficiency in older adults linked to a 50% higher risk of atrial fibrillation, a dangerous irregular heartbeat that increases stroke risk. It's also associated with dementia risk, type 2 diabetes, and chronic inflammation, essentially accelerating aging throughout the body. That's why many doctors call magnesium one of the most underrated nutrients for seniors. Here's the encouraging part. When deficiency is corrected, the changes can be noticeable. Deeper sleep, fewer muscle cramps, sharper focus, steadier mood, better balance, fewer falls. Not all supplements are equal though. Cheap forms like magnesium oxide absorb poorly and often cause diarrhea. Better options are magnesium glycinate, citrate, or malate, gentler and far more absorbable. Most seniors need around 250-400 mg daily, depending on diet and health. Food helps too. Leafy greens, pumpkin seeds, almonds, avocados, beans, lentils, oils, even dark chocolate. But modern soil depletion makes food alone often insufficient, which is why supplementation can be life-changing. Magnesium isn't flashy, but fixes the deficiency and many aging problems. Cramps, poor sleep, brain fog begin to fade. Now let's move to number 3, the one your skin can no longer produce enough of, vitamin D3. If magnesium is the helper, vitamin D3 is the master switch. It determines bone strength, immune defense, and brain function. After 65, your ability to make vitamin D from sunlight drops by more than 50%. Combine that with indoor living, sunscreen, or weak sunlight regions, and deficiency becomes almost inevitable. Vitamin D3 isn't just a vitamin. It acts like a hormone affecting nearly every system. It regulates immunity, supports cardiovascular health, reduces inflammation, and protects brain cells, lowering risk of depression and cognitive decline. A 2022 study following over 25,000 adults found those taking vitamin D3 had a 36% lower risk of death from all causes. But many people make mistakes. They take vitamin D2, the weaker form, or doses too small to reach optimal levels. Most seniors require about 2,000 to 4,000 IU daily. Though blood testing is the only way to know, the target blood level is 40-60 ng/ml, while many seniors fall between 15 to 25. And vitamin D3 works best with vitamin K2 and magnesium. D3 absorbs calcium. K2 directs it into bones instead of arteries. Magnesium activates the entire process. Food alone rarely supplies enough vitamin D3, so supplements are usually needed, and its effects go beyond bones. Stronger immunity, steadier mood, better muscle strength, fewer fractures. Now, number 2, vitamin K2. K1 handles clotting, but K2 directs calcium. It pushes calcium into bones and keeps it out of arteries. Without it, calcium can harden arteries even with calcium in D. With it, risk drops sharply. The Rotterdam study showed a 57% lower heart disease death risk and stronger bones. 2 forms exist, from Malawi and quatches from animal foods, and 7 Malawi and quatches from fermented foods. 7 Malawi and quatches works best for supplements because it stays active longer. Most seniors need about 100-200 mcg daily. Together with D3 and magnesium, it protects bones and arteries. Now, the most important omega-3 fatty acids, EPA and DHA. After 60, this may be the most valuable supplement because it supports nearly every aging system. It helps memory, lowers Alzheimer's risk, reduces inflammation, stabilizes heart rhythm, lowers heart attack and stroke risk, eases joint pain, improves mood, and preserves muscle strength and mobility. You need marine EPA and DHA, fatty fish, fish oil, or algae. Plant omega-3 converts poorly with age. Most seniors need around 1,000-2,000 milligrams daily. Choose purified oils and consult your doctor if using blood thinners. So remember, avoid retinol, vitamin A, unnecessary iron, calcium alone, and high-dose B6. Prioritize magnesium, vitamin D3, vitamin K2, and omega-3s. It's not about more supplements, it's about the right ones. Aging well comes from smarter choices. If this helped, share it, like and subscribe.